Americans are good at popping pills. According to the Mayo Clinic, 7 of 10 Americans take prescription drugs. Here's the problem. Medication often has bothersome side effects, and therefore researchers are always looking into alternatives to improve quality of life. Today I want to look at the pros and cons of one of those alternatives, placebo drugs. First, I will look at how placebo drugs can eliminate side effects, and then I will look at their effectiveness. But before I begin, what is a placebo drug? A placebo drug is a pill that has no active ingredient, so therefore it has no capability of treatment. Let's look at it this way. If I was to give you the placebo for Mucinex, it would look exactly like Mucinex, and you wouldn't be able to tell the difference. However, the component of that placebo drug would be more similar to that of a Tic Tac because it's made of sugar and it won't actually treat you. The idea behind it is that a patient believes they're being treated, and therefore the mind is tricked into making the body feel better. This is called the placebo effect, and it's often used for mood and pain treatment. So for this speech, I will be focusing on anxiety medication. Now that we know what a placebo drug is, what would happen if I replace anxiety medication with the placebo drug? Let's look at the positives first. The positive is that a placebo drug is just made of sugar, so there's no side effects that come along with it. Let's look at a study done by the American Heart Journal. 33 musical students were analyzed for their performance anxiety. 1 hour before their performance, they were split into two groups, one given diazepam, which is an anxiety medication, and the other a placebo. During the performance, they were analyzed based on their hand control, their tone, and their tremor. And it was found that diazepam and the placebo pretty much had the same effect. However, after that performance, students who had taken diazepam were more restless. So in this case, the placebo was just as effective as the active drug, and it removed that symptom of restlessness. However, this isn't the case for everything. Often, the effectiveness of placebo drugs are inconsistent. Let's look at a study done by the American Journal of Psychiatry. Young adults with generalized anxiety disorder were split into two groups. One was given pregabalin, an anxiety medication, and the other a placebo. For 6 weeks, they were analyzed for their anxiety and depressive symptoms, and it was found that pregabalin was way more effective than the placebo drug. The question now becomes, should we replace anxiety medication with the placebo drug? Well, again, placebo drugs are convenient in the sense of they eliminate side effects. However, they're super inconsistent in effectiveness. It depends on who, for how long, and what active drug they're replacing. Here's the thing though, it's not a question about should or shouldn't. It's about looking at a remarkable idea of tricking the mind into feeling better. What if in the future I had a patient with anxiety and I could trick their mind into not feeling anxious while simultaneously not having to worry about giving them a medication that they may feel addicted to, or giving them a medication that makes them gain weight or lose memory. This is the goal of placebo drug research, and this is why it is so important. It's not about should or shouldn't, it's about the idea of studying the mind.